This presentation provides information on appeal timeframes and guidance for submitting medical necessity and claims appeals. For our Medicaid plans, members have 60 calendar days from the date of Superior's Notice of Adverse Benefit Determination letter to appeal the decision. Appeals can be submitted in writing and also via fax and phone. Please note that information for submitting an appeal can be found on the denial letter that is sent to both the member and the provider. Superior has 5 business days to acknowledge the appeal. We then have 30 calendar days to review the appeal and provide a response letter. An emergency or expedited appeal is used when Superior has to make a decision quickly based on the condition of the member's health, and taking the time for a standard appeal could jeopardize the member's life or health. The emergency appeal decision will be made within 72 hours unless the appeal is related to an ongoing emergency or denial of continued hospitalization. Appellant and provider will be notified of the appeal decision within 1 business day for denials of ongoing emergency or denial of continued hospital stay. CHIP members have 60 calendar days from the date of the denial letter to appeal the decision, and AMBETTR members have 180 calendar days from the date of the letter. Superior will again acknowledge receipt of the complaint within 5 business days. A standard appeal will be completed within 30 calendar days, and expedited appeals will be completed in 1 business day. Appeals can be submitted in writing to the Austin office or by fax, and can also be submitted over the phone. Appeals for WellCare by Allwell must be filed within 60 calendar days from the date of the notice. For standard appeals, a written decision will be provided within 30 calendar days of receipt. Please note that the decision may take longer if an extension is requested or if we need more information about the case. In these cases, you will be notified that more time is needed and why. If the appeal is for payment of medical services or items the member has already received, we will provide a written decision within 60 calendar days. For expedited appeals for WellCare by Allwell, a decision will be made within 72 hours after we've received the appeal. Medicare members can request for an expedited appeal if they or their doctor believe their health could be seriously harmed by waiting up to 30 calendar days for a decision. Members cannot request an expedited appeal if they are requesting us to pay them back for the medical services or items they have already received. We will automatically give an expedited appeal if the doctor asks for one on behalf of the member, or if the doctor supports the member's request. If a member requests for an expedited appeal without support from the doctor, we will decide if the request requires an expedited appeal. If we do not give a fast appeal, we will make a decision within 30 days. The member's representative, or their doctor must ask for an appeal. The written request must include the member's name, address, member ID, the reason or reasons for appealing, whether they want a standard or expedited appeal, and any evidence you want us to review, such as medical records. Requests for expedited appeals must also explain why it should be expedited. Appeals for WellCare by Allwell can be submitted by mail, fax, or phone. Appeals can also be submitted electronically. Please note that if you request a standard appeal by phone, you will receive a letter confirming what you told us. In order for Medicaid and AMBETTR members to continue services, members must request an appeal either 10 calendar days after the date of the original denial letter, or the day the appealed service will be reduced or ended. The member must state in the member request that the member wants to continue services. The denied services must have been previously authorized, and the time period covered by the original authorization must not have ended. If all these requirements are met, the services will continue until the member cancels the appeal, the member's appeal is denied, or the appeal decision has been rendered as denied. Providers for Ambetter and CHIP members will be given the opportunity for a peer-to-peer during the appeal. A fax notice will be sent to the provider indicating a reasonable opportunity for a peer discussion with our medical director by calling 1-877-398-9461, option 3. Timeframes for requesting a peer-to-peer for a standard appeal are 2 working days for prospective and 5 working days for retrospective. If it is an expedited appeal, providers only have 2 business hours to request the peer-to-peer. Claims appeals are different than medical necessity appeals. A claims appeal is a request for reconsideration of a claim for anything other than medical necessity and/or any request that would require a review of medical records to make a determination. Claims appeals must be submitted within 120 calendar days from the date of adjudication and can be submitted electronically through the Secure Provider Portal or in writing. If submitted on paper, the claim appeal form must be used, and all claims appeals should include documentation supporting the appeal. Examples of supporting documentation include, but are not limited to, a copy of Superior's EOP, a letter stating why the payment is incorrect, an EOP from another insurance company, documentation of eligibility verification, prior authorization number, and a certified mail receipt as proof of timely filing. For Ambetter and WellCare by Allwell, a request for reconsideration is submitted when there is a disagreement with the manner in which a claim was processed. Reconsiderations may require medical records if related to code audits, code edits, or auth denials. They can be submitted orally or in writing using the appropriate form and must be submitted within 120 calendar days from the date of the EOP or denial. Resources outlining the appeal process can be found on superiorhealthplan.com for Medicaid, Medicare, and CHIP, and ambetter.superiorhealthplan.com for Ambetter members. We hope you have found this information helpful. We appreciate your participation in our network as we work together to transform the health of the community one person at a time. If you have additional questions, please contact your provider representative or provider services. Thank you and have a great day.